Okay, I think we're live. We live? All good? Okay, we're live. Hey, my name's Josh Musick. This is my dad, Marvin Musick. We are excited to be with you tonight. We're going to be talking to you about the Medicare mistake that could cost you $10,000. This is definitely a real mistake. We've actually seen this many, many times. So we're going to give people a minute to get into the live stream. We do want to let you know that once we're done talking about the $10,000 mistake, we're also going to be sitting here for maybe an hour or so, and we will answer your questions. So you can pretty soon start putting questions into the chat, and we'll just go through them one by one. Last time we did it, and there were hundreds, and we got to hundreds. So we'll see how it goes tonight. Real quick, in the chat, everybody, let us know where you're from. Say like hello. We're sitting in Overland Park, Kansas. That's where our office is. So drop in the chat where you're joining us from, please. We're going to give everyone a few minutes to fill in, and then we'll get started on the $10,000 mistake. Tampa, hello Tampa, Oregon, Ohio, York, Pennsylvania, Arizona, Nashua, New Jersey, Massachusetts, New Jersey, Texas, Virginia, New York, Tennessee, Missouri, Florida, Texas, Florida, Connecticut, California, LA.
All right.
This is awesome.
That's great.
Welcome, 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 everyone. St. Louis, just down the street from us. Arkansas, Wisconsin. Okay, so Dad, the $10,000 mistake that we have seen, I mean, we've actually seen much larger than that.
Oh, yes.
Yeah.
In fact, 10,000 would probably be minimum with this particular mistake. And really to understand how this $10,000 plus mistake occurs, really only two things you have to understand. First off is when we have a claim, who pays first and who pays second. And so there's some very hard and fast rules about payer position. So here's the way it works. Anytime a person is no longer working, they don't have a group plan available to them, Medicare is always the first payer. The secondary payer could vary. It could be a retirement insurance. It could be a supplemental plan. It could be any type of insurance that a person selected to be in the second payer position. So the first idea around this is who pays first. So if I'm no longer covered by an employer-provided plan, it's always Medicare, and then whatever is second. Now, if I am working still, or my spouse is working still, and we're covered by an active employment-provided plan, then what determines first and secondary payer is the size of the employer. How many employees are at that company. And it doesn't mean they have to be necessarily covered by the group plan. It just means how many people on the payroll. Yep. And so that could be full-time, part-time, combination, doesn't matter. So here's the way it works. If I am working for a company where my spouse is, we're covered by that plan, and there's 19 employees or less, then that group plan only pays second once I'm eligible for Medicare. And so Medicare takes the first payer position when the group is 19 or less. Now, if the group is 20 or more employees, then it's just the opposite. Medicare is going to take the secondary payer position, and the company plan is still going to pay first. All right? So that's the first concept to understand this mistake that people make. Who's going to pay first? So if we're still working, it's size of group. If we're not, it's always going to be Medicare. All right. The second thing we have to realize to avoid the mistake is who has to go on Medicare at 65. Not everyone has to, but many have to. And so the ones that have to go on Medicare at 65 would be anyone that they are covered presently by a retirement plan. That retirement plan could be yours, it could be your spouse's, it could even be an ex-spouse for that matter. But if you're no longer working and you're on a retirement plan, you have to start Medicare at 65. Number two, if you're covered by COBRA insurance. COBRA, sometimes we use it for a while, not real long, it's usually expensive. Sometimes it's favorable if the employer's going to pay for it. But if I'm on a COBRA plan, once I'm Medicare eligible, COBRA only pays second. And so Medicare has to be put in the first payer position to do that. So again, you're required to go on Medicare at 65 if you have COBRA. If I have an ACA plan, same thing applies. What happens with ACA plans, they actually will let you stay on an ACA plan at 65, but you shouldn't do it because all the financial incentives of an ACA plan are going to go away at 65.
Like the subsidies?
Yeah, subsidies go away, cost sharing goes away, you pay the full premium, pay the full deductible, so there's no reason to do that. All right. And then if we have someone that's on TRICARE insurance, TRICARE is only for those that are retired from the military. Wonderful insurance, but it changes at 65. TRICARE gets you to Medicare eligibility as the first payer, but once you're Medicare eligible, again, it's only going to pay second, and Medicare will pay first. Same thing is going to be true with 19 or less. So here's my point. So we have these people that sometimes don't realize that they have to go on Medicare at 65. Retirement plans, ACA plans, TRICARE for life, 19 or less employers. And if they don't opt to go on Medicare at 65, what happens is that plan is sitting over in the secondary position. And if they have a claim, Josh, I'm talking about a claim, it could be as little as $12,500. What's going to happen? That secondary insurance now, let's say they're going to pay 20%, where Medicare would pay 80, but if you don't enroll in Medicare for Medicare to pay the 80, now you have to pay the 80%. Yeah. So truly a $12,500 bill, that's nothing. Then that person would be out of pocket 10 grand. I had a lady that had a $100,000 bill, and what had happened was her HR department told her to keep her COBRA till it expired. She should have gone on Medicare. She could have kept the COBRA for a while, but she just kept COBRA only. Turned 65, has a bunch of health problems, and now COBRA says, no, we're only going to pay second. It's actually Cigna. And Cigna didn't do anything wrong. It's just the way it works. But they paid second, and because she did enroll in Medicare, she had to be the first payer, and that literally cost her $80,000.
And I think like where we've seen that mistake happen so many times is maybe people get laid off and they're over 65, or there's some sort of like a benefits package that's offered to them. Yeah. And the HR department's like, hey, we're going to pay your insurance for the next 18 months because that's part of the package. And so, the consumer, the beneficiary is just sitting there going, great, I got free insurance for 18 months, but they don't realize they're already over 65 and COBRA doesn't count. Mm-hmm. So COBRA actually takes that second position. Medicare is going to take the first. And guess what? If you don't have Medicare, you're in the first, right?
Exactly right.
And so HR people are great and awesome, and they have the best of intentions, but sometimes we've seen that
they don't understand
advice
Medicare
coming out of that. So
exactly right.
So let's say that is the scenario. So somebody is offered a package like that, and they want to take advantage of that. Mm-hmm. What do they do?
Well, what I would recommend, once they've started their B date, I don't like them to keep the COBRA any longer than 6 months. And the reason for that is once we start at our B date, we're going to be in what's called the Medigap open enrollment period, where we don't have to qualify to get a Medigap policy. And so I'm fine to take that COBRA up to that 6 month window. But if I keep COBRA beyond that, now I just lost my Medigap open enrollment period. Yeah. And if I have any health problems, I'll never be able to qualify to get a Medigap policy. And so now here's another thing we do. We'll have people that their spouse or maybe kids even are covered by that COBRA plan. Yeah. So we go ahead and tell them to keep the COBRA for sure. But as far as their claims, when they go to the doctor, they go to the hospital, we're going to use Medicare and a supplemental plan.
Makes sense. Okay, anything else you want to share on that? If not, we'll get to some questions.
No.
So guys, start dropping your questions in here. I am going to start scrolling through here and pop some up on the screen really quickly once I can get past where everybody's tuning in from. Okay. Will this be recorded?
Some of those that were first.
Yeah. Okay. Here's the first question from John. If I join my job Medicare Advantage program when I turn 65 this past April, when can I change to a supplemental insurance with no underwriting? I get different answers from different experts.
Okay, so what he's saying is he is on Advantage plan through an employer type plan. Okay. Yeah, well, here's the way it works. Whenever you voluntarily or involuntarily lose employer coverage, you are then eligible to go on a supplemental plan with no underwriting. Okay, it's called a guaranteed issue product, and you can do that without underwriting. Now, when you lose that plan, you only have a 63-day window to make that decision, but you're able to get off Advantage and go to SUP with no underwriting because of losing that employer provided plan, voluntarily and involuntarily. Yeah.
Okay, T. Bernard. And guys, just want to welcome everyone. If you're just joining us, my name's Josh Musick. This is my dad, Marvin. We both run this company called MedicareSchool.com. We're an education-focused independent broker for people who are wanting to start Medicare. We do everything with Medicare A to Z, from helping you find the right supplement plan, drug plan, Advantage plan, whatever plan is right for you. help you get enrolled in Medicare and Social Security and really anything Medicare related A to Z. And our services are always free. We're paid by insurance companies, not by you guys. So just want to welcome you to this. You can go back maybe once the show is over and listen to the $10,000 mistake that we've seen a lot of people make. But for the rest of this time, we're going to be doing some question and answer. So hop into the chat, ask your questions, and we'll get to them. Okay, T. Barnard says, do we have to get on Medicare? What's the cutoff? I turned 65 in July. How many months do I have?
Okay. Well, it just depends if you're covered by an employer-provided plan, as I mentioned earlier, that there's 20 employees at the company or more. That could be your company, it could be your spouse's company, doesn't matter. You don't have to go on Medicare if you're covered by a group plan, 20 or more employees. If you're not, then every other scenario, you have to go on Medicare at 65.
And he did type in here, he has no insurance right now. He's 65 as of July. So
all right. Yeah, you definitely need to. And the big thing for you, what's his name again? Okay. Anyways, I want to make sure you know that you have to start at 65 and you only have a 7-month window to enroll into Medicare without penalties and problems, and that's called your initial enrollment period. So if your birth month is in July, then you had 3 months before, a month of July, 3 months after. So you're in that next month. So if you enroll this month, August, into Medicare, your A date is going to be July, but your B date is going to be September 1, and you're still fine. But don't go beyond next month because that'll be your final month of your initial enrollment period. So you need to get on it pretty quickly.
Yep. Give us a call. We can help you walk through that. Our phone number is down there at the bottom. So you can see 800-864-8890. We can walk you through all of the things you need. Okay, this is a similar question. We'll hit it real quick. Anthony says, turn 65 in May. Do I need to sign up for Medicare Part A or Part B? So May, June, July, August. Yeah, this is your last month.
Okay, and he's talking about this past May.
Yeah.
Okay, you're exactly right. If you mean May 2023, then you're down to the wire. Now, again, if your spouse covered by, you're covered by a group plan, 20 or more, you don't have to. But if no work plan's available, you need to start Medicare. And if not, what's going to happen is you'll be eligible to enroll next year, the first quarter. That's called the general enrollment period. But your coverage is going to be delayed. And so this is the time to do it.
Okay, how do you recommend we protect ourselves when traveling internationally?
Okay, great question. Here's what happens. If you decide to get a Medicare supplemental plan, there's actually 10 supplemental plans on the market. If you're born after January 1st, 1955, starting Medicare after January 1, 2020, you can only get 8 of those 10. And you're only going to buy one, but the point is there's 8 options. And of those plans, there are 4 or 5 of them that have attached to the MedSup plan a foreign travel emergency benefit. And it's a lifetime benefit. Right now it's $50,000. So if you travel abroad outside the U.S. or outside the U.S. territories, then Medicare is not going to pay for anything, and you probably know that. So what's going to happen is that supplemental plan that has this foreign travel emergency benefit sets aside this bucket of money. And if you have a claim, the way it works, let's just say we had a lady had a $170,000 claim in Ireland. And so her $50,000 bucket was, exhausted very quickly. And she actually had a $120,000 balance. And so what happened was she wisely had purchased, before she went on her trip, travel health insurance. And she had a $100,000 policy, so it paid $100,000. The supplemental plan that she was on paid $50,000. She had a balance of $20,000. So I really recommend travel health insurance. Now, I will tell you, they are not all created equal. Those policies are different. And so the way you identify a good policy is, of course, read it, but you want to make sure it also has an air evacuation rider. So if you're somewhere you can't get good care, hey, this happened. We had a lady in Costa Rica. She falls getting out of the shower, breaks her femur and her hip. She was in a place they couldn't take care of her. They literally put her in a van, moved her 10 hours by van, couldn't help her there. So they bring in a helicopter or plane, I can't remember which one, in Florida to San Diego. The flight cost $260,000, $270,000, but it was covered because she had a $1 million air evacuation rider. So my point is, make sure not all travel health insurance policies are good. So find a good one. You can call us. We don't sell them, but we can refer you to some companies that we do trust.
Okay, Constance says, I'm 64, working full-time. I don't plan on stopping anytime soon. I am covered through my employer. Do I still need to sign up for Medicare at 65? And the answer to that is probably not. As long as your employer is 20 or more, you're good to go.
That's right.
You can now. What we would probably say is you're wise to compare your employer insurance to Medicare to see what's available. And so a good rule of thumb on that, and I hope I'm speaking this correctly, is if you're spending somewhere around that $250 range to have you covered at the employer, you probably need to look at Medicare. Another thing is if your deductible's over $1,500, right, you need to look at Medicare. And you meet it, right? Because we know we can get you on Medicare Part B, which is $165, maybe a supplement plan for $135. We're around that $300 range, and you'll have amazing coverage, limited to a $226 deductible. So don't just assume that you shouldn't look at Medicare if you're still working past 65. But if you got a plan that's $50 a month costing to, have you covered, and it's got a $250 deductible, you're probably best to stay on that employer coverage.
Exactly right. And frankly, Medicare's glad you are. That's why they make it so easy for you, Constance, to come into Medicare once you lose the group plan. You come in through what's called a special enrollment period. And it's easy, it's seamless to do. As long as you keep coverage at the group plan to 65 with no gaps in your coverage, you'll have no problems in the future.
Okay, Joni says, if I'm covered by an employer plan and enroll in Medicare, do I need to cut my employer plan? And the answer to that's absolutely not. There would be no reason to have all that. In fact, you would just get tied up in insurance claims. Everyone would be saying they have to pay, and you have a problem.
Yeah, I would tell you what I would do is definitely consider dropping the employer plan. Now, if it's free, that's pretty tough. I understand that, and you got to look at, do I have others covered in my family under that plan? But as a general rule, most people that have a kind of a mediocre group plan get off of it totally. Go on Medicare, get a supplemental plan or Advantage plan, and you'll be well served. So otherwise, you have over insurance.
Greg Knight, in what situation is it wise to get a MedSup versus a Medicare Advantage? Serious conditions. Go ahead.
Yeah, well, I think it is MedSup is the best decision for most people. Not all people, but for most people. So when you say wise is it wise? Because remember this, Greg, if you take a MedSup plan, you will not have to deal with networks. When you have an Advantage plan, you're either going to have an HMO or a PPO network, and you're definitely going to have limitations of providers. Not everyone takes Advantage plans. Sometimes a doc may take one company and not others, or maybe they'll take the HMO and the PPO or not. And so you're always dealing with network issues on Advantage plans. If you have a MedSup plan, you can go to any provider, any hospital, any doctor that takes Medicare. And so that's why it's wise, because we don't have provider issues with MedSup plans. Number two, if you take a MedSup plan, you will never have to deal with pre-authorizations by the insurance company. The way that works is if Medicare says it will cover something, doctor says you need it, end of story. You get that knee hip replacement, CAT scan, MRI. And so you're never fighting an insurance company to get the services that you want and that you need. Not so with the Advantage, because they say right now about 70%, 72% of the services on the Advantage plan are going to have to be pre-approved by what? A private health insurance company that's in the business for profit. We've seen people that needed a full hip replacement. Advantage company said, no, we'll pay for a rod only. Had people regularly that need a knee or hip replacement, and they say, no, go to therapy. Go get some shots in that knee. And so they don't approve sometimes some of these things that happen. And so you got to live with that. Now, it doesn't mean they don't approve everything. It just means that you're going to have those issues where there may be some interference with the insurance company. Yeah. So as long as a person can afford a little extra to get that supplemental plan, that's what we'd recommend. You have to decide, how do you want your insurance to work? What happens if you get cancer? What's going to happen? Do you want to deal with networks? Do you want to deal with pre-authorization? Or do you just want everything to be covered and covered well?
Yeah. Okay? You put in here serious conditions. I don't think you touched this, but let's say you were to go with a Medicare Advantage and be like, hey, I'm healthy, a couple of years, and then something. Did you talk about that? Mm-mm. Okay, so let's say you go on a Medicare Advantage plan because, hey, they're free and they're on the TV and everyone seems to be hyping them up. And, 2, 3, 4 years down the road, something changes in your health because, right, we're all going to get older. Something's going to change in our health at some point. At that point, it's going to be too late to get a Medicare supplement plan, right? Because you're going to have to medically qualify. And it's kind of like waiting until the house is on fire to call up the homeowner's insurance agent and say, hey, I need insurance, right? It's just too late. So if you have, especially if you're coming into Medicare and you've got some serious conditions, you're going to want to get that Medicare supplement right away because you're in that 6-month Medigap open enrollment period, no health questions asked. But if you get beyond that, you're going to have to answer health questions, go through medical underwriting in order to get the MedSup. Right.
Yeah, and this really what we want everyone to understand, that unless you live in New York, Connecticut, Maine, or Massachusetts, in every state, all the rest of the states, if you're going to get off your Advantage plan you've been on for 2, 3, 4, 5 years or whatever, you're going to have to medically qualify to make that switch back to a supplemental company. Those companies don't have to take you at that time. They can say, no, we don't like the fact that you had cancer 2 years ago, or you had, you have early stages of dementia or whatever. AFib, there's a good example. So there's certain health conditions, even medications today, that insurance companies, they won't approve it just because you're taking a certain med. They have the right to deny it, and that's very frustrating for people that would really like to have, quality insurance.
Okay, next question. Is it possible to change the supplement provider without penalty after a year? I think the answer to that is yes. Without penalty. There would be no penalty. You would have to answer health questions if you want to change. A lot of people think once you get a supplement plan, you can switch around. That's not true. That is why it's really important to make sure that you go with a carrier that's got proven rate stability. And if you call our office, we'd be happy to walk you through what those options are for your area.
Yeah, but no penalty.
Yeah, no penalty. My company is cutting back on jobs for existing employees, layoffs, termination, retirement. My option is retirement. I will be 66 in January. There goes my company insurance. What next to do?
He'll be 66 in January. So
Yes.
you're already beyond your initial enrollment period. That was January earlier this year. And so what you're going to do, Randy, is right now, and you can start doing this now. You definitely need to start doing it right around September, October. But what you're going to do is you're going to come into Medicare using what's called the special enrollment period. You're going to have your HR department fill out a form called an L564, verifying that you have been working and you've been covered by an employer plan. HR fills that out, and then you will submit another form called the CMS 40B, and these two documents go to your local Social Security office. You can fax them in, mail them in, or drop them off, and you're going to request that your Medicare start January 1st, 2024. And so the L564 proves that you're eligible to come into Medicare after 65, no penalties, no problems, and the 40B lets them know when you want to start. So the group plan's over December 31, you roll into Medicare January 1, 2024. Now you can pick out a drug plan, a supplemental plan, or an Advantage plan, whatever else insurance you're going to need. You'll do that again, really, anytime after September 1, you start making these arrangements. But we don't want the L564 to be any older than 90 days. So you're getting close to the time frame where you can start getting this all set up. And by the way, we do this multiple times every day, all over the country. Happy to walk you through that entire process. Our Medicare guides, our agents are well versed in all this, and they can tell you what to do. We'll fill out the PDF forms for you, send them to you, and you get them to the right department.
Yep. Call us. We'll just walk you through it.
Yeah.
It's easy for us. Okay, well, let's try to do some quick ones here. Is G&D paid with your Social Security check as B, or do you set up a bank draft? So answer that is G, like your supplement plan G will never, ever, ever be paid for out of your Social Security check. It's always going to be a bank draft. The Part D can be bank draft, or they can pull that out of your Social Security check, just like they do Part B. So you have the choice on that.
That's right. B has to, D can if you want to.
Yeah, and G can't. Okay, this is a good question. Pamela Ward, want to welcome everyone also that's in our Facebook group. I think we've been answering a bunch of YouTube comments, so I'm trying to grab some Facebook comments through here, so welcome. If you guys aren't in our Facebook group, it's called MedicareSchool.com Community. We've got, I think, 40,000 people in there, and people are helping other people every day. It's really cool. Just, help understand Medicare. You can ask questions in there. People, post their experience with this plan or that plan. If you're an agent, don't join the group. If you're trying to sell people, don't join the group. That's not what it's for. We're going to kick you right out. But for all the rest of you, that are learning about Medicare, wanting to start Medicare, go join that Facebook group. And we'd love to assist you in there. So back to Pam's question. I had to go on disability at age 60. Will I be disqualified for a Plan G at age 65? I have 3 more years before I turn 65.
Okay, Pam, here's the way it works. You were first eligible for anything you wanted when you first went on your Medicare A and B at age 60. And that's called your initial enrollment period. So what's going to happen for you, and by the way, this is good news, as you approach your 65th birth month, you're going to come into what we call the IEP-2. and you're going to be able to make brand new decisions about your Medicare. And they really treat you as though like you've never had Medicare before. You just kind of get to reset the clock. Now, your Medicare number is not going to change and your A and B dates are not going to change. But when we submit that application to a Medicare supplemental company for that Plan G, they'll see that you're in your IEP2 period. There's no underwriting, and you'll also be able to get a typical 65-year-old med sup rate, so you won't be penalized because you came in with a disability originally. Make sense? So that's your, I know you got a couple years away, but you will not be disqualified. You absolutely will be eligible for that G plan at that time. No underwriting at all, and you'll get great rates.
Some people just think like, hey, I'm already on Medicare, I'm going to sail through this. Don't. At 65, if you're on disability, just do a complete review of everything. Because you're eligible for all these plans you weren't before. Okay, Constance, following up, she said, I understand my employer has 35,000 employees, so assuming I stay employed, can I just stay on their coverage for another 5 years and sign up for Medicare when I turn 70? The answer to that is yes, absolutely.
Hey, Constance, I had the oldest people so far I put in Medicare was a 79-year-old lady. Her husband was 83. And she was the one who's working. He's retired, covered by her plan. So, hey, you can come in anytime you want. Frankly, Medicare's glad you keep working because they're not responsible for you. Remember, you'll come in using special enrollment period. And hey, Constance, one other thing, you be sure to have no gaps in coverage now back to 65. So if you keep working, you want to be sure to stay actively employed and covered by a group plan with no gaps at all in your coverage back to 65. Very important.
Okay, happy day. I'm a veteran. How does Medicare help me?
Okay. Well, it just depends. If you are using the VA is not going to bill Medicare. Okay, they're both government agencies. You're eligible for VA because you served in the military. You're eligible for Medicare, if indeed you are, because you paid into the Medicare tax system. So they're two totally different systems. So what I tell veterans is this. If you like the VA, you're happy with the doctors, you're happy with the service, then that's a wonderful option you have. But you may want a civilian option. And so for a civilian option, I think the smartest thing to do is what's called an MA-only plan. And by the way, those of you that are listening to this, I would say the same to you if you have TRICARE or if you have FEHB, which is Federal Employee Health Benefits, your retired civil service. I think this is a great option for all groups of people like that.
So veterans, TRICARE, FEHB.
And FEHB, exactly right. Those three groups of people. So what will happen in your situation is your civilian option would be what we call an MA-only plan, Medicare Advantage only. It covers inpatient and outpatient, but it doesn't include prescription drugs. You'll continue to get your prescription drugs at that low copayment program through the VA, and then what happens to you is that Medicare Advantage company will actually give you some type of a credit, and it varies around the country, but it's anywhere from about $50 to $100 a month, and that Advantage company gives that back to you on your Social Security check. So yes, you're going to be enrolled in A and B to have the Advantage plan, but they're going to reduce that down because you're getting your meds through the VA. So I think that's a wonderful option. It gives you VA as an option. It gives you a civilian option. Now, let me just share this with you, just so you know. If you decide just to use the VA only, you're not required to do Medicare A and B. But we find a lot of people get disappointed in that because now all of a sudden they're just stuck in that system. They don't have a way out, and then they want to pick up B at a later date, and now they're going to be penalized. And so I would recommend A and B. Get an MA-only plan. Get your meds to the VA.
Yeah. Those MA-only plans, they really are built for the people who served our country.
Yeah, they're called Patriot plans, honor plans. I mean, they're really designed for...
Yeah, Eagle plan. Trying to think. They're always...
Yeah, they're really
kind of patriotic names, and they're just loaded up with benefits that, honestly, I wish everybody had, but they don't. So take advantage of them. Call our office. They're not available everywhere. Call our office. We can look it up and see if one of those MA-only plans is available for you. Okay, Dale Jennings says, I saw your videos on dental and vision. Should I look into private policies?
Okay. Well, I think so. And the reason I do is because I think dental hygiene is critical as we age. We want our teeth to be healthy because they're going to affect other parts of our health. So I would get a dental plan. Dental plans, there's a good dental plan. Here, I'll tell you the one I'm on. My dental plan covers $2,500 a year plus cleanings. That's a good benefit. I pay like $45 a month for the plan. The good time to buy a dental plan is as you're retiring. If you've had a group plan, as long as we set up that dental plan within 60 days, then you have no waiting periods at all. You have wonderful immediate coverage. You'll have your preventive covered 100%. You'll have your basic services 80-20 or maybe 90-10, and then your major services are at 50-50, and you'll have immediate coverage if you're coming off of a group plan. So that's the right time to buy. A Vision, a Vision's add-ons are inexpensive. You have a couple different networks, iMed or VSP. That's going to range anywhere from $10 to $15 extra a month, and there's a lot of dental plans that will actually allow you to add Vision to that. Now keep this in mind. If you have A and B with the supplemental plan, you already have wonderful, wonderful vision. You've got coverage for glaucoma and cataracts, macular degeneration. All kinds of great coverage. All the medical stuff.
Not routine.
What you don't have is one eye exams for eyewear or eyewear itself. So that's why people get a vision plan if they have glasses or contacts and they feel like they'll get their money back out of the plan. I'm a lot bigger on dental than I am on vision. I can tell you that. I think vision's fine. It's inexpensive. If you have an Advantage plan, they usually give you a dental allowance and a vision allowance.
Okay, good. Brad DeArc, how hard is it to switch Part D plans once you have been on one for several years past age 65? It's easy,
Simple.
easy. There's no medical questions or anything. Here's what you have to do. You have to wait until October 15th, and then you can enroll in a plan, and that plan will start January 1st of every year. So that's the annual election period, October 15th to December the 7th. It's about 45 days that you can choose your drug plan. And if you call us, we will assist you with that. Now, the way we do drug plan changes around here is a little bit different. We will actually set up everyone an account on our site. We put all your medications in it, and then every year it takes about 10 minutes for you to log back into that site, update your medications list, click a couple buttons, and it says, oh, you're on the right drug plan, or oh, you're on the wrong drug plan. And if you're on the wrong drug plan, it says this is the one you should be on, and you click enroll. So the idea is in 10 or 15 minutes a year, you've renewed and you've made sure that drug plan is really the right plan for you.
Right. Yeah, take the time to do that. That's 10, 15 minutes of time well spent.
Yep.
Because drug plans can change from year to year.
Okay.
No underwriting required either. I guess you mentioned that.
Oh, yeah, no underwriting. Just
pick a plan in your zip code, and you can have it.
Okay, keep the questions coming, guys. We're going to get to them. Next one, I was told to take Part A now and could start Part B. I'm assuming you're going to say later. I may have that reverse. It doesn't sound like it. A lot of people do it that way. They take Part A because they're going to continue working. Part A is realistically probably not going to cover anything while you're still working, but you can take it. And then Part B, you would start using the CMS L564 and the CMS 40B form when you do retire.
Yeah, and keep in mind, Anthony, if you have signed up for Part A, whenever that goes into effect, if you have a health savings account, don't put any new money into that account. That's one of the negatives about taking Part A. You can no longer contribute to an HSA. So that's why we tell people that are still working, a group of 20 or more, you or your spouse, don't sign up for anything in Medicare because, number one, you won't be penalized for picking up A at a later date. As long as it's free, it's always free. And if you do take A, you can't put new money into your HSA. So if you don't sign up for A, you can keep funding that HSA.
Yeah, that's a good point.
Okay, so
and a lot of people, there's like this myth or this lie floating around that you have to take Medicare when you turn 65, and that's just not the case. And if you think about it, it makes sense, right? Why would the government penalize you for staying on employer insurance? They'd rather you stay on that employer insurance for 150 years, right? So they never have to cover you. So they're not going to penalize you. They start penalizing you when you go without coverage.
That's right.
Right? Because then you become a strain on the system. Okay. Daniel, go for it. Oh, I thought you had one. Is Blue Cross Blue Shield C Plus a Medicare supplement plan? That is a very good question.
Yeah, Blue Cross Plus,
C
Medicare
plus. So Part C, right, is any Advantage plan falls under Part C. You have A, B, C, and D, and Part C are Advantage plans. So it may be. There's also some carriers out there. Blue Cross and Blue Shield might be one of them that they try to roll out these kind of variations that are
lookalikes.
Yeah, lookalikes. They're not really that popular, but sorry, I can't be more of assistance there.
Yeah. Well, here's the thing. You can find out, can you go to any provider you want to? It's a supplemental plan.
There you go.
Yeah, that's a good way to do that. Do you have to deal with any kind of networks? You can call them and ask them that. If they say yes, well, then you're not on a supplemental plan. Ask them what your out-of-pocket expense is going to be. because if you're on a G plan, the most is the B deductible. So ask a few questions and you ought to be able to discern whether that's a advantage or not.
Okay, Mark Sirota, if there is a Medicare Advantage plan within my zip code that has a zero deductible, zero out of pocket mostly, and a MOOP of $1,000 per year, would you take this plan? I mean, if you're going to go on an Advantage plan, like you've chosen, hey, I don't want to get a supplement plan, I'm okay with networks, I'm okay with pre-authorizations, I'm okay with permanency, meaning if I want a supplement, I've got to go through health underwriting down the road. If you've decided an Advantage plan is right for you, sounds like a great Advantage plan, as long as your doctors are in it, as long as all your medications are covered by it.
Yeah, Mark, that is a very good deal, and I think Josh is
sounds
accurate.
like you live in Las Vegas
or Florida
or Florida.
Yeah, but as long as you're content with some of those variables that come with the Advantage plan, that's a fine decision. And we're not here to beat up Advantage plans because they can be fine coverage. We just felt ethically we have to tell people to make sure you understand what Advantage plans are packaged with. The agents want to talk about all the perks, and we want to remind you, hey, this is how it's going to work. Pre-authorizations, underwriting to get off of them, networks, those kind of things. And if you're comfortable and happy about that, go for it. Not a bad deal. $1,000 out of pocket is great.
Can you pop up the HSA one right there? Let's just Donna Hollifield? Yeah, right there. Okay, let's just to piggyback on, because we were talking about HSAs a second ago. Can I put HSA in a partially, no, do the one right below it, Mike Pierce.
We can answer
That's
hers.
a better one. We'll do them both at the same time. When I took full Social Security while still working, Social Security signed me up for Part A, but as I was still working, I contributed to an HSA not knowing what should I do.
Okay. So what happened is they call it, you overfunded your HSA. You put money in that HSA that was really ineligible. Now, your accountant can make any of the corrections. So also what happens when you overfund it, whatever money you put in you should not have put in, there's going to be a 6% penalty on that, and then you're going to have to pay income taxes on that money that went in. You don't have to pull the money back out. It's already in there. They'll charge you the 6% penalty, and it's going to be subject to income taxes. That's the way it works. Okay, and let's go back to her question because I think it's really good what she asked about HSA. So, Donna, you're asking about partial year. Here's the way it works. Right now, and we're going to talk about individual plans. Family plans are a little bit different, but individual plans right now, this year, maximum contribution is $3,850 for the whole year. If you're above 55 years or older, you can put an additional $1,000 in your HSA, which is called a catch-up. So we're eligible for $4,850 for the year. But what happens, let's say that I'm going to go on Medicare in October. And so I could have contributed to my HSA for 9 months. So you would take that maximum amount for the 9 months and it's prorated. So in my example, it's going to be about, like $3,600. You can't put in once you have Medicare A, but you can put in the allowable amount up to the maximum until you start Medicare. Hopefully that helps.
I don't know. That's a great name. Ida No. Okay. Do most physicians take Medicare? Are there situations where they don't? Well, I don't know. So.
Okay. Here's the way it works. And the answer is, yeah, most physicians do take Medicare. Very few don't. However, because Advantage plans have grown so much over the last several years, there are some physician groups that they'll only take a certain Advantage plan. In other words, they've contracted with that particular insurance company. So you could run into that where they don't take Medicare, just Advantage. It's few and far between, but I have seen it before.
It's usually the other way, where they don't take Advantage, like by far.
Oh, for sure.
Yeah.
But in fact, I can't even tell you the last time I've had it come up where
I've heard of it once, and it was like third string, and who knows if it was even true.
Yeah.
I mean,
yeah.
That's my experience. Okay, let's do Donna Berger. I'm 66, employed at a large company, and enrolled in Medicare Part A. Should I immediately go on COBRA to avoid insurance gap for pre-existing conditions, or enroll in a Part B or a SUP plan?
Okay, I can tell you exactly what to do, Donna. Once you have set that retirement date, you're not going to use COBRA, really. Okay, yeah. So what you're going to do, let's just say it's going to happen in October. So you're going to do your SEP paperwork, your L564 and your 40B, and get all that set up so that you transition off the employer plan and you're immediately on Medicare A and B with the supplemental plan. Yeah. Okay. Now, if the COBRA is paid for, if it's paid for, you do have that window where you have that Medigap open enrollment period, 6 months of your B date. And so we're all right using that for a few months, but not too long, because you don't want to lose that eligibility to get a supplemental plan without any underwriting. Okay, so don't push the envelope too much. But I will tell you this: if you're paying for that COBRA, you're going to come off as soon as your job is done, and you're going right on Medicare. It's a very seamless, easy transition, and we'd be delighted to do all that for you.
Okay, let's pause. So my name is Josh Musick. If you're just joining us, this is my dad, Marvin Musick. We run this company here called MedicareSchool.com, and we do two things here. Number one, we try to educate people. If you're confused, struggling with Medicare, check out our YouTube channel. And also go to MedicareSchool.com. You can watch our Medicare Essentials workshop. There's a 20-minute version and a 40-minute version and a 60-minute version, depending on how detailed you want to get. But it's going to really walk you through everything you need to know as you're just beginning Medicare so that you don't make a mistake. That's the first thing we do. The second thing we do is we've got a team right outside our studio, about 80 people out here that every single day just help people with Medicare. We just love the opportunity to get to serve people all over the country. We're independent brokers licensed in all 50 states. Our services are free, so if we can assist you with Medicare one-on-one, call that 800 number that's down scrolling along the bottom, and we would consider it an honor and a privilege to help.
Yeah, you would.
Okay, next question. Let's see. Oh, this is good. Currently work for a large medical organization. I am working for another year and am 3 years post-cancer treatments. Will I qualify for Medicare Part B supplements?
Yes. Why? Because of once you start your Medicare, remember that B date is the key. You will be able to get any Medigap plan you want, company you want, during that 6 months of your B date. You can apply 6 months before, but once that B date hits, you're in that Medigap open enrollment period, so the answer is yes. Now listen, if you were 5 years post-cancer, it's a non-issue anyways, because most carriers will even approve an underwritten case if cancer is 5 years or older. But that within 5 years, it could be denied if you had to go through underwriting, but I don't know, you don't have to go through underwriting.
Likely, as long as you don't have Part B.
Yeah, as long as you don't have Part B. Once you start your Part B, you can get a MedSup plan 6 months. No underwriting.
Okay, what information do I need to have ready when I call you to purchase a supplemental plan?
Okay, all right.
Number one,
yeah, go ahead.
We're excited to have you call. So
Yeah, we'd be
call away.
thrilled to help you. First off, we're going to look at all your medications, if you're taking any. So we'd like to know the name of the med, your dosage frequency that you're taking, what's your pharmacy choices. We typically like to have about 3 different pharmacy options, retail options. And remember this, folks, anytime you get a drug plan, you always have a mail order option. Medicare's not like group plans where they make you use mail order, but it's always an option. So we're going to look at all your meds, and then we will go through and look at all the options, Medicare Advantage plans, Medicare supplemental plans. If you decide you want a supplemental plan, then we're going to look at all the carriers that are in your market. We'll show you all the initial premiums. And by the way, we show you our screen and even the agent if you'd like. We're fine for you to see us. And then we'll also talk about stability of rates. We will look back at the stats on these carriers to see how frequently and how drastically have they raised their rates in the last 10 years, because we really want to go with a company that not only has a good rate now, but what's the likelihood of that rate being stable in 3 and 5 and 10 years down the road. We care about that. So we'll take the time. By the way, most of our appointments are hour and 15 minutes, something like that. So we're not going to rush you. We'll answer your other questions that you want and really take the time to make sure you're making the choice, not us. We're just going to give you the great advice.
Yeah. What we're really out here doing is we're trying to resist the model of the big call center. So we've talked to so many people that have, you guys get all these calls, the telemarketing calls day in and day out. And they are paid, the people that are sitting in those chairs are paid based upon speed. How fast can they get you to buy a plan? And if they can do it in under 11 minutes, guess what? They get a bonus. And we just think that's disrespectful, right? That's not how you're going to be on Medicare 20, 30 years, right? I mean, who knows how long? And the decisions that you're making should not be done in 11 minutes.
Yeah. When the agent cares about the commission, they will be speedy. They're just going to push an Advantage plan because they pay better money. They're not going to be thorough. But when the agent cares about you, they will take the time to ask you questions and answer your questions and be sure that you understand what you're doing. That's what a good agent is. And by the way, Josh and I and our team, we're not the only good agents in the country. There's other people who care about others and want to do a good job. But the norm is sell a fast deal, make a quick buck, and get on down the road. And you'll never hear from those people again.
Yeah. We put as much or more money into our client support team than our sales team. I mean, It is like the biggest focus because we want you guys to stick around for life and tell all your friends about us as well.
Yeah. And by the way, we're not perfect, okay? We're flawed people too, but we do our best to make sure that we take care of people.
Okay, WM Marty says, my wife will be 65 in January. She smokes. Will she have to pay more for a supplement plan?
Okay, just depends on the state you're in. Some states, the initial rate is based upon age, gender, and tobacco status. Some states, it could be just based upon where you live. That's called community rated, so it really varies state to state. I would tell you as a norm, smoking is not an issue, but it could be. Very few states. So anyway, point is, probably not. But if she were to switch, it would be those kind of things. Mostly at 65, they don't consider tobacco as a rate up.
Okay, I do not know the answer to this, so hopefully we're not walking into something here. Could you explain what the hold harmless protection that exists only if you have Medicare payments deducted from Social Security? You know what I mean?
Yes, I do. Okay. Well, hold harmless. It's not Medicare payments. He's talking about Medicare Part B premiums. Okay. Here's what happens. And by the way, this hold harmless has not been an issue for several years. But there were a few years where there were no cost of living adjustments that occurred in Social Security. Last several years, there's been COLAs where the Social Security goes up. But what happens if we do not get a cost of living adjustment and our Social Security is the same, what happens is our Medicare Part B premium cannot go up when everybody else's goes up. Every year, let me say this, usually Part B premiums go up. They didn't last year. But if Medicare makes the decision to raise the Part B premium, but your Social Security check did not go up, you're held harmless for that increase in the Part B premium. That's what that means. Make sense? Okay, so that's it. So the bottom line is, hey, listen, I think we're going to get a slight COLA this year. I mean, I think it's going to happen, maybe 5-6%. So I think the Part B premium is probably going to go up maybe, $15-20.
This person says, can I call, let's see, Anthony, sorry, can I call your number for support tomorrow? Absolutely. Phone number is going along the bottom of the screen. If you call in, if you need our support team, you can definitely get to them through that, or you can just tell them, hey, I'm new to Medicare. Need somebody to assist me.
And Monday to Thursday, 7 to 7. Monday to Friday, 7 to 6.
Yep. Okay, is Aetna PPO a good plan? And the answer to that is...
Yeah, I think Aetna's a good company.
Yeah.
I like PPOs better than I like HMOs.
Yeah.
I still prefer MedSup plans, but sometimes it's just not a fit for people. And so I think a PPO is fine. I think Aetna is a fine company. Mm-hmm. I really do. So, yes.
Which D plan is good if you don't take any medication? Only vitamin D. Well, that's good for you.
The cheapest one you can find. I would just go on a low-cost drug plan. Now, I will tell you this, though. In fact, I had a lady call me today about this. There is a very low-cost plan right now. And the problem with that plan, I'm not going to say what it is, but it's cheap. But what happens if you get on a Tier 3 medication, I think you got a 25% co-insurance. Pretty sure that's right.
Expensive.
That can be expensive. So what we like, the one we primarily write is going to be in that $10, $12 range a month. Good formulary, and they don't try to, charge you excess. Whatever.
Yeah,
I'm just saying to you, I think that I would take a low-cost plan. Don't get a high-dollar plan because you can always change drug plans on an annual basis. If you take more meds the next year or less meds, you can always switch those. So,
and I think a temptation for a lot of people in your shoes is, hey, I only take supplements. Do I need to even get a drug plan? So the implication that there's two implications if you decide you don't want to get a drug plan. The first one is you're going to be penalized for the rest of your life. And that penalty is not big. It ends up being about, if you were to go without drug coverage for a year, that penalty would be $4 every month.
For life.
For life, right? So that's a penalty. If you went without 2 years, it'd be about $8 a month for the rest of your life that you'd pay over and above your Part D premium. So that's the first one. Don't want to pay a penalty. The second one is Medicare is going to drastically reduce the opportunity that you have to enroll in drug coverage. And you're going to have to enroll in that drug coverage during the annual election period, which is October 15th to December the 7th, with coverage starting January 1st. So let's say it's February, you get put on a medication that's $6,000 a month, right? And we have that stuff all the time.
All the time.
6, 15, I mean, it's all over the map. But let's say it's February, you're going to have to pay out of your pocket through the end of the year before your drug plan that you purchase October 15th can start January the 1st. So that's really the big risk. The penalty, no one wants to pay a penalty, but that restriction on when you can enroll is the big deal.
Yeah, get a little $10 plan. I hear it all the time. Hey, Marvin, I can get my meds through, Cost Plus, a drug company, Cuban's Group. I can get it through GoodRx, cheaper. Okay, that's fine. I'm glad you can. But we don't get a drug plan just for what you're taking today. We get a drug plan because you may need a $16,000 a month medication. Listen to this, folks. Right now, self-administered chemotherapy pills are $7,000 a month. $7,000 a month. Okay, you'll be grateful when you have a drug plan that you pay a fraction of the cost for those meds. So
Absolutely.
Get a drug plan. It's not because we make a lot of money on them. We don't. It's because you'll spend more money on meds on average than anything else in healthcare today.
Okay, let's see. There's some questions about FSA and HSA. Okay, do I no longer have the chance to put money in my FSA after I get into Medicare? Assume I'm retired now?
That's right. Only when I talked about not contributing, those are HSAs, health savings accounts. Okay, flexible spending, you can keep putting into that. It's not a problem. Remember how they work. They don't accumulate like an HSA. You set aside $2,000 a year. You got to use it or lose it. But keep doing your FSA. I'm just said no longer HSAs.
Okay, I'm almost 65 on disability. Is there any advantage to sign up with Medicare if I am, I found the rest of it, on my husband's work insurance with over 20 employees?
Okay.
Let me find that question again. I'm almost 65 on disability. Is there any advantage to sign up with Medicare if I am on my husband's work insurance with over 20 employees?
Okay, this is tricky, and here's why. Because there's different rules. And she's on disability now?
She's on disability on her husband's employer, over 20 people.
Okay. So wait, yours is different. If a person doesn't have disability and there is 20 employees or more, they don't have to go on Medicare. But if they're on disability and there's 100 employees or more, they don't have to go on Medicare. So if she's in a group, an employer plan that has 99 or less employees, she has to go on A and B. That's the way it works. Yep, that's the way it works.
Wow.
Yeah. So I don't know how many people are in the company. So
maybe
it
she'll tell
changes.
Can you keep an eye on that? It's Sherry Klein.
Yeah, we're happy to.
If she puts in.
Sherry, we're happy to follow up on that one, but that's the way it technically works.
Okay, let's skip here. Betty, I do not know what to sign up for. I turned 65 December 17th of this year. Just received my blue and red card today. Need to get physical workouts, items for some care, help with meds. Here's probably the best advice. Give us a call, right? Well, if you've got your Medicare A and B card, give us a call. We'll walk through it, if you qualify for special help or anything like that. Walk you through all the different plan options that are available.
Yeah. And Betty, what I do, if you can, go to our website, MedicareSchool.com, and watch the Medicare Essentials Workshop. You'll learn so much, and we got a couple different versions on there. And then call in as well. Our guides know all that. They're able to walk you through that, but at least we give you kind of a feel as to what you're getting into. And you do have some time. You're not like it's, rush. You're going to start December 1. It's time to get serious about it, but start that education process.
Lori McCarty, as a dependent on my husband's HSA, can I take Part A, and can he still contribute to the HSA?
Okay. All right. So if you take Part A, he can no longer contribute to the family amount, but he can contribute to his own HSA, and that limit, again, depending on how old he is $4,850 if he's above 55. But he cannot put any money that would go towards yours. And also remember this about HSAs: when I give you these limits, it's employer portion and your portion. That's the total amount.
Okay, Steve Mason's hamstrings are recovering. Okay, I signed up for Part A and B when I turned 65 last March, and still working, and disenrolled in Part B since my employer covers me. When I retire, can I enroll in Part B and get a sub?
Absolutely. Yeah. And the reason for that, Steve, is because you'll do the paperwork that will bring you into B with no penalties, and you'll have a brand new B date. And so from that B date, 3 months, 6 months before, 6 months after, you're still in that window to get the supplemental plan with no underwriting required whatsoever. So you're fine. They'll restart the B.
Okay, J.S. Irwin, tobacco. Let's see. How long does one have to be tobacco free to get the better rates? I've been off for about 10 years now.
12 months.
Yeah, I
Yeah,
think
they'll
it's
just
only a
ask you
year.
that when it comes up, have you had any form of tobacco products in the last 12 months? That's it.
Okay, this is a longer one. Someone in our Facebook group, says, my husband will be 65 on September 22nd. He plans on working another year or so. We plan on A, B, G, and a drug plan. I understand that he doesn't have to do anything with Medicare paperwork until 2 to 3 months before he wants to start A and B, so he doesn't have a gap in work insurance and Medicare insurance. Is that correct? You've got a perfect understanding. I would start that 3 months before, not 2 months before.
Yeah,
but
right.
you have a perfect understanding. Give us a call. We'll help you walk through that paperwork because you're going to need the SCP paperwork, CMS L564, CMS 40B. Employer's going to have to sign off on that, and then you'll want to get your drug coverage and your drug plan set up and in place.
All right.
So you're doing great. Let's see. I will. Oh, this is a great question. Haven't had this one yet. Kathy says, I turned 65 in February. I'm not starting to collect Social Security until 67. How do I pay for Part B?
All right, sounds great. And so it's February, so let's back up the clock. January, December, November. So anytime after November, maybe even October, you can, with an myssa.gov account, you can go online and you can enroll into Medicare A and B. And by the way, Kathy and anyone else will help you do all that if you want us to do it. We do it every day. But once your A and B is set up, what's going to happen is they're going to send you an invoice. Since you're not on Social Security, they'll send you an invoice for your Medicare Part B. Now, the very first invoice varies. It could be 2, 3, 4, or 5 months of premium, and then after that, it will be on a quarterly basis. Now, there's a lot of people that they don't want to pay quarterly, or they'd rather set up some kind of a bank draft. So here's what you can do until you start Social Security. You can enroll in what is called Medicare Easy Pay, and you give Medicare an account number and a routing number, and they will do a monthly bank draft to cover your Part B premium. Or you can actually go to and set up a mymedicare.gov account, and then you can go on there and pay your premiums through that system. And by the way, both of those will allow you to use a credit card. And so if you keep points and all that, once you go on Social Security, then they'll stop those payment systems and they'll start taking it right out of your Social Security check. Okay, so that's how it works. And your bill will be due January the 25th. It's always the 25th of the month prior to when your coverage begins. And you usually get it about a month prior.
Okay. This brings up something that I think is interesting. So a lot of people who are turning 65 February and January, February, March, they think that you're going to get the last quarter of the year, the airwaves and the amount of mail you're going to get is going to be tremendous because it's the annual enrollment period. And everyone and their mother is going to be yelling about December 7th as some sort of a deadline in order to get coverage. I just want you to know, if you're just now aging into Medicare, meaning you're just now turning 65, whether that's December, January, February, March, April, that December 7th deadline has nothing to do with you whatsoever. It is for people who are currently already on coverage who are wanting to switch their plan. So don't get caught up in the hype that December 7th, you've got to make your decisions if you're turning 65 sometime early next year. That's not the case. You're just like anyone else in terms of you can do it all the way up until your effective date. Or even after. Okay, Cav says, question, I lost my job and turned 65 this year. I still intend to continue working and actively looking. With that, I signed up for Part A and B. Should I continue both? Would I get employed again?
Okay, well, number one, you don't have to keep B if you have an employer plan that is going to have 20 employees or more in the group. Okay, you don't have to have B. You can drop B. But what I would do before I drop B is see how attractive the employer package is going to be for health insurance. Sometimes it's great, and if it is great, then you go ahead and drop Medicare Part B. And the way you do that is there's a form called 1763. And you'll tell them you don't want B any longer. They'll ask you why. You'll say, because I went back to work and I have a group plan. You're not going to be able to disenroll from Part A. You just have to stay in Part A. Once we've started Part A, you have to stay in the A system, which is no big deal. Just don't contribute to an HSA. So if your employer has an HSA option, don't elect for that because it's not possible because you have A. Okay, but yeah, if the group plan's good, drop B. submit the form to the local Social Security office, and you can pick up B at a later date when you decide to retire again.
I also think it's important to know that you have A and B right now, right? Well, I don't know how long you've had it. I don't know how long your job search is going to be. But if you want to get on a supplemental plan, you want to do that within 6 months of your Part B effective date. So don't miss that window. Don't want you to miss that. Otherwise, maybe you could regret that for the rest of your life. Connie Jaw, what insurance provider has the lowest premium for a supplement G? That's an impossible question to answer because it's different everywhere in every zip code all around the country.
Yeah,
but I think what is important is talk a little bit about initial rate versus stability of rate, because it's not always the lowest premium that is the most important.
Yeah, when we look at rates, Connie, we look at two things. The initial premium you're offered when you come into Medicare and you get the insurance. But you want to look at how stable has that company been, because truly some companies, they may write new business at a lower rate, knowing full well that they're going to start bumping those rates up because they have the right to do that. Again, pay attention to the initial rate, but look at the history of the companies. And we actually have a service that we subscribe to that allows us to go back and see how these companies have performed in the last 10 years. And so we always bring stability of rates to the table. So I think you ought to look at that also. Yeah, and Josh is right. It really varies. In one market, it could be, United Healthcare. Another market could be Aetna. Another market could be Cigna. It could be Blue Cross. Whatever. It just truly varies. It depends on how aggressive a company wants to be in that particular market.
Okay, For Real says, I think these guys are up front and would use them, but have previously committed to another. Well, I'm sorry to hear that.
That's all right. Hey, we hope things go well for you. We do. We know there's some other great people out there.
Okay, this is a good question. E. Smith, my wife was on my corporate plan and went on Medicare in February when she turned 65. She went on a dental plan and was told she had to wait a year to get her implant done. Should she have to wait a year? Depends. Yeah. Mm-hmm. There are certain dental plan carriers, whenever you go on Medicare, that you can get that have what's called, I think it's CPC, credit for prior coverage. And so as long as you're coming off of a dental insurance from like an employer or something, then that 12-month period should be waived. So I would reach out to that insurance carrier and say, hey, she had, credible coverage prior. Can we provide the proof of that? And then that will happen. If they allow that, they'll waive that. Now, one thing that would be good to know is if you're not coming off of employer coverage or some other credit or prior coverage, you will have to wait. And if you think about it, it makes sense, right? If you're maybe you're spending $45 on a dental plan or $40 a month on a dental plan, and you pay that for 1 month, you go in the next month and you have $2,000 worth of work done, and the dental plan pays for that, and then month 3 you cancel the plan. Well, that's just not going to work, right? The insurance company can't make that work. So that is why they have those waiting periods or delayed benefit periods. But oftentimes, if you're coming off employer coverage, you should be able to get credit for that. So I'd reach out to them and ask them.
Mm-hmm. Yeah.
Okay. I am already... Oh, this is a good question. This is fun. Okay. I am already on Medicare. Thanks for helping me enroll last year. This year, should I call Medicare school or will you proactively call us to renew? So you should have got our first communication yesterday. It went out to all of our clients, so check your email, but it's just kind of saying, hey, there's nothing to do right now, but what you do need to be doing is you need to look for, in the month of September, you're going to get something called an annual notice of change, an ANOC, A-N-O-C. And what it is it's going to be, this is what's changing. It's going to be a document that says this is what's changing in your plan for next year. And this comes out for Advantage plans and it comes out for drug plans. So nothing really you can do right now. There's no new plans out. There's no point in getting involved in anything because that doesn't start till October 15th. But in September, look for that annual notice of change and read through it. So a lot of people think that during the annual enrollment period, October 15th to December 7th, everyone's out here changing plans. And that is just simply not true. Every year, it's usually between 9 and 11% of people actually make a plan switch. Okay, so almost 9 out of 10 years, you're not actually going to do anything. And the motto we've lived by for the last 15 years is if it ain't broke, don't fix it, right? If the coverage is fine, if it hasn't raised a bunch in price, if your meds are still covered, if everything looks good, there's probably not a lot of reason to jump ship. these insurance companies have figured like, okay, we need to get people on the plans, and then we need to not change the benefits too much, otherwise everyone's going to leave us. So these plans have become a lot more stable over the last several years, and we're just seeing more and more people stick on it. That being said, if you read your annual notice of change, and let's say one of your medications falls off the formulary, okay, you need to make a change. Let's say you're on a drug plan that's costing you $20 a month and it goes up to $60. That happened 2 years ago for a lot of people. There was a plan that tripled in price, but people didn't read that annual notice of change. And so got to January 1st, and instead of getting a bill for $20, they got a bill for $60, and everyone was mad. So you're it's not to say that you won't switch, but a lot of people don't switch other than maybe every few years.
All right. And I just want to add that you have a supplemental plan. Those are written for life, and so you can keep those forever. And if you want to change because of a premium increase or whatever, just let us know that, and we'll reshop that for you. Happy to do it.
But to go back to your original question, yes, we proactively communicate and we proactively reach out. And so if you're on an Advantage plan or a supplement plan and want to switch to a different Advantage plan or a different supplement plan, we have a coverage renewal team. They're all licensed, highly trained by my dad, and they will walk you through all of the different options that are available that we represent, and make sure that you get on the right plan for next year. If it's a drug plan only switch, we have a website. We will send you your username and password. All of your medications are stored in there, and we send you the way the website works. You log in. It's got all your medications. You look at them, you say, okay, did I change any meds? Oh, I added one and I dropped that one. Okay, you make the change. And then it's going to say the drug plan you're on is the right one or not. And if the drug plan that you're on is right, there's nothing you need to do. The plan will auto-renew for next year. However, if it says, hey, that's not the right plan, you need to be on this one, then you click enroll, and 5 minutes later, you'll be enrolled in that plan. You don't need to cancel the other plan. It'll automatically switch over at the beginning of the year. So that's how we handle drug plan changes, and it's worked well for many, many years. Okay. My scenario is different and soon than my husband above. I'm 65 in December and plan on retiring in February or March of 2024. I need to make an appointment with Tara. Great. Okay, this is a good opportunity. So this question came from our Facebook group. In our Facebook group, if an agent reaches out to you, like sends you a direct message or something through Messenger, and her name is not Tara Yancic, don't engage with that person. There are agents in there who try to reach out and say, hey, I'm with Medicare school and I want to help. That's not going to happen from our team, right? The one you should be talking to, if you're in our Facebook group, her name is Tara Yancic, and she is amazing. She works around the clock, way too much, making sure that she gets to introduce herself, find out a little bit about your situation, build a relationship with you, and then get you to the most appropriate person to help you that's on our team. So anyway. Yeah,
and just to comment about that as well, because you're looks like you're going to start in February or March. If your birthday's in December, what would happen is your B enrollment is going to be done a little bit differently. So if you're going to start in February, we actually would submit the paperwork in January. If you're going to start in March, we'd submit it in February. So your little timing here is kind of tricky, but Tara knows that very well. So you just need to really be paying attention and do that correctly. There's one lady had asked about something about Tennessee. Okay.
Where is it?
She had asked about if you want to move from supplemental plan to supplemental plan, do you always have to go through medical underwriting?
Well, just answer, yeah.
I don't see a big answer for and in Tennessee, I am like 99% sure you do. You do. Okay, good. So once you've been on that supplemental plan 6 months of your B date, then to move from one to another, you are going to have to medically qualify. Which is 25, 30 health questions. We have to check your meds, and we submit that information to the underwriter.
Okay, Marvin said, or Ida, has said, Marvin, I've been to 3 of your seminars prior to COVID, and I've told many of my fellow employees to look at your YouTube site to learn all they can and to call. Thanks for everything. Well, thank you for referring us. We really, really appreciate that from the bottom of our hearts.
Yeah, that's right.
And guys, hey, go to MedicareSchool.com. If you're just joining us now, you can learn about Medicare. There's a workshop on there to learn everything you need to know, Medicare A to Z. And then when we can help, give us a call. We'll walk you through your options. Okay, next one. Jill S. I am 66, working full-time on employer coverage, retiring this coming November. I enrolled in Part A and B last summer on bad advice. When I retire, we'll be able to choose a SUP plan without medical questions.
Okay. Well, the way that's going to work for you, Jill, is
Maybe limited?
Yeah. Well, she'll be guaranteed issue on a G.
Okay.
Yeah.
There's going to be like maybe a loophole you can jump through, but if you call us, what we'll probably do is we'll ask you a few health questions and get you through. That's the easiest, as opposed to jumping through the hoops. We can help you jump through the hoops, though. But just give us a call if now is a great time for this, right? November, yeah, it'd be perfect time. Give us a call even tomorrow and get you enrolled. And if we'll ask you the health questions. If you can qualify, we'll go that route. It's just easier and fast. If not, we'll jump through those paperwork hoops with you.
Hey, Jill, another thing we've done with a lot of people who realize they made a mistake, she can disenroll from B and make that effective immediately and then pick it back up in November. Yeah, you can do that.
So
Yeah.
17, what's the 1764?
1760. You gotta think that through, but I'm just telling you, I've done it lots and lots of times. When you made a mistake, you can undo it. You'll save a couple months of B premium, and then you can pick it back up in November, and then you can have any supplemental plan you want.
Okay, Alan Weaver, 3 to 4 routine visits a year, no significant health issues, G or N, currently on ACA in Washington. I turned 65 in January, wife not until March of 25. What options for her health care in 24? Well, I think she would just stay on an ACA plan. It would be an individual plan at that point because you would come off of it. As far as G or N, it would kind of come down to price. They're both going to be good plans. The differences between G plan and N plan, there's only a couple. So the G plan, the only out-of-pocket that you're responsible for medically is the Part B deductible. This year, that's $226. So once you've paid that $226, it's 100% coverage after that on a G plan. On an N plan, you're responsible for the $226. You have a $20 doctor copay. Every time you see a doctor, you've got a $50 emergency room copay. And then you are also responsible for any excess charges. And an excess charge is when the physician says, hey, whatever Medicare is going to pay me, I'm going to tack 15% onto that bill. And the G plan would cover that. But on the N plan, you are responsible for that. So if you go to a doctor who charges an excess, then you'll have to pay that additional 15%.
And they can do it in Washington.
Yeah, and at the end of the day, people are like, hey, I'll just go to doctors that only that accept Medicare assignment. They don't charge an excess, and that's all well and good until you're laying on some surgery bed after a car accident and the anesthesiologist comes in and he charges an excess and you're like, hey, no, I'll just do this pain free. You're not going to do that, right? So
or go to most cancer specialty hospitals charge excess.
Yeah. So G or N, either are going to be fine. You're going to save some premium dollars on the plan N. We help quite a few more people in the plan Gs than plan N, but they're both good plans.
Yeah.
Okay, does Medicare automatically send a card before you sign up? Because I noticed the Medicare form asks to put a Medicare number at the top of the form. I'm not sure what form you're looking at.
Well, the 40B asks for it.
Yeah.
The Medicare number. Let's say it this way. First off, if you're on Social Security, you're going to be automatically enrolled into Medicare. So I'm assuming this is someone that's coming in after 65. They're dealing with a special enrollment period. So what you can do if you don't have a Medicare number and they're asking for it, just write in their SS number, and they're fine with the Social Security number. If we're talking about the 40B format, I think you are.
Yeah, but so let's maybe use this opportunity to talk about enrollment. So let's say you're turning 65. People ask, do I have to be automatic? What do I have to do? Mm-hmm. So if you're going to go on Medicare, if you're taking Social Security, you're going to be automatically enrolled into Medicare A and B. Your red, white, and blue Medicare card is going to show up about 100 days in advance of the month you turn 65. The way that works is any time from the 2nd to the 31st of a month that you turn 65. So let's say your birthday is August 17th, or it's August 2nd, or August
31.
Yeah, just later in the month, and you apply for Medicare. It's going to start on August the 1st. Now, if you are born on the first day of the month, they actually back that up a month. So if you were born on August 1st, you're actually eligible for Medicare July 1st. So anyway, you'll get your card automatically mailed to you 100 days before the very first month that you're eligible. if you're receiving a Social Security check. If you're not receiving a Social Security check, you're going to need to self-enroll. And you can do that a few different ways. You can go to the Social Security office. Lots of times that's probably a 90-day wait on that. So you call, you wait on hold for an hour, and they say, we're going to set up an appointment, and the first one available is going to be 65 days from now. You can do it that way. Or you can go into myssa.gov, and sign up for an account there, and there's a button there you can click to apply for Medicare A and B, and you can walk through that process. It takes about 10 minutes. It's pretty simple. If you call us, our agents are out here every single day helping people walk through that process. So if you want somebody to hold your hand through that Medicare A and B enrollment process, we'd love to do that too. So, okay. I am on, let's see, Medicare now with Part D automatically included. When I take Social Security, I may lose my Medi-Cal. Can I buy a supplement Part G then without a penalty? I don't think so.
Yeah. Yeah,
because they're already on Medicare.
Yeah, I think when you lose your Medicaid, which is the Medi-Cal, then I do believe you have the opportunity to be able to pick up a supplemental plan with no underwriting.
Okay.
Yeah, I think you only have. We don't do a lot of that type of business, just so you know. But I mean, I've read a lot about it. But you have, I think, within 63 days of losing your Medicaid eligibility, you should be a guaranteed issue on a Medicare supplemental plan.
Okay, J.S. Irwin, I do not have a primary doctor, never needed one. I had cataract surgery 3 years ago. Do I have to have a primary physician before I can get A and B and supplements G and D? Absolutely not. The only time you have to name a primary care physician is if you go with a Medicare Advantage HMO plan. HMO. Okay, so if you have a supplement, no networks. PPO, you don't need to name. You're going to have a network, but you don't need to name a primary care. But the HMO, you absolutely will have to have the primary care physician.
Yeah, that's right.
Okay, let's see. We've talked about this quite a bit. We can hit it real quick. Wife will be 65 in April. I will be 65 in July of 26. So April next year, July 2026 on Cobra through 12/31/23. Then another high deductible plan prior to Medicare for 2024. Do I need to prorate the wife's portion of HSA for 2024?
Yes,
yeah,
you do. Yeah. So here's what you can do. You're eligible to contribute for January, February, and March. That's it. So take that $48.50 divided by 12. Of course, it'll be a little bit more next year, but basically $400 a month. So you're going to be finding that $1,200 to $1,300 range towards her HSA.
Okay, question. My wife intends to cover me through her employer for vision and dental. Is that okay if I'm on Medicare?
Absolutely. Yeah, usually the medical and that's kind of separated in these employer plans, so it's fine. And we encourage people to do that because it's usually a better price than what you can get on the market. So that's great.
Let's see, what is it? Oh, the video's freezing. Okay, we're good. Okay. Oh, here, this will be fun. I take 3 tier 3 drugs and some generics. According to current information, I'm going to save a lot of money starting in 25 because of the OOP cap. What's the catch?
Yeah, well, there is no catch. The Inflation Reduction Act that was passed changed a lot of things that are happening with Part D plans. So in 2025, what's happening is the max out of pocket will be $2,000 for the whole year. Now, 2024, it's going to be better, and you'll find this out because typically on Tier 3 meds, you end up in catastrophic stage. And right now, that's 5% copay. This year, it's going to be 5% copay. It's 5% copay this year. Catastrophic next year is 0 copay. So what I'm trying to say to you is that in 2024, most people spend no more than about $3,200 out of their pocket because there's no catastrophic stage. In 2025, max is $2,000, and the neat thing about that is it can be paid throughout the year.
Wow.
Yeah. It's not one lump sum, $2,000. You can spread it out.
Interesting. Okay, Mark Stein, the Social Security office told me that if I want to stay employed with my big company and keep their insurance, I don't need to enroll in anything at 65. Is this true?
Absolutely, it's true. That's right. You don't have to do a thing. 20 or more in the company, good to go. Pick up Medicare later. Just make sure, Mark, that if you change jobs, you don't go ever without employer coverage. And so if it looks like there's going to be a gap where you're going to be without employer coverage, then you go on Medicare for a month or two, and then you can always drop the B and then covered by another employer plan. That's where people mess up if they keep working after 65. If you change jobs and you transition, you don't want to go without active insurance, and COBRA doesn't count.
Okay, next one. My husband qualifies for the F plan. Does he need to take it, or can he take the G plan? Might be somewhat cheaper.
Okay. All right. So right now, the only reason that I would tell someone to take an F plan is if they have to, and that would be this: if they were eligible for Medicare prior to January 1, 2020, which meant prior to January, he was born before January 1st, 55, which sounds like that's the case. And so if he's coming off of an employer-provided plan, and he can't qualify for anything through underwriting, then he is going to have to take an F plan. But if your husband is fairly healthy, then I would not pay the additional premium for an F plan. I would go through underwriting and pick up a G plan or an N plan.
Yeah.
Okay, but if he can't qualify, then he will have to take an F.
Okay, I'm turning 65 in February 2024. I'm retired military. Are there any gaps I should be concerned about when using Medicare A and B and TRICARE for life?
Yeah, not at all. As long as what you have to do is, when you approach February, you want to make sure that you are enrolled in A and B, and then you would notify TRICARE what you've done the enrollment and what your Medicare number is. TRICARE wants to know that. And then, James, what you could do, and a lot of TRICARE people are doing this, is they're taking MA-only plans. And the reason they're doing that is because of the perks that come with the MA-only plan. You get your meds through TRICARE insurance, and then you use the MA-only plan, and the balance that would be out of pocket on the Medicare Advantage is submitted to TRICARE, and they will cover you 100%. So and my point is, TRICARE will coordinate with A and B, or TRICARE will coordinate with that Advantage plan. And you want to get an MA-only, no drug plan, because then they'll give you a reduction on your Part B. And we do these all day long. So Josh was talking about earlier, honor plans, Patriot plans, Eagle plans, those kind of plans are really, really designed for people that have TRICARE for life. It's a great option. And the good thing is, too, you're not like most people, if they ever want to get off of it, they have to medically qualify. You don't. You can drop that in a year and go back just to TRICARE by itself.
Okay, this one, let's not answer this, but it says, if I'm traveling abroad in India, Medicare will cover my medical expenses. Once this wraps up, which we're just a few minutes away from wrapping this up, go back to the beginning of the video. We talk about travel insurance and how Medicare and the different plans cover medical expenses while you're traveling very extensively. So
and the answer is no. Answer is no. Okay,
maybe some, but yeah. September 1, I will be on Medicare. I don't have a doctor. Is their website good for finding primary care docs that accept Medicare? If it depends on what you want to do, but you can. We'd be happy to walk you through, and we can look up your zip code and say, hey, these are the ones that do that. I don't know of any website in particular that would be consumer facing that somebody could go to. Most doctors really do accept Medicare.
Yeah.
When we get into accepting Medicare Advantage plan, that's a little bit different.
Yeah, that's what I would do. I'll just ask around neighbors, family, friends, somebody, and see who they like, and then just call the doctor to ask them, because almost all of them do. Now, sometimes they'll say they're not taking new Medicare patients. That happens, but normally there's docs that'll take new patients. Yeah.
Okay, I started receiving full retirement. I'm guessing the Social Security benefits in April when I turned 66 in 4 months. Still working full-time at present. Plan to retire December 23. When should I file for Medicare Part B? Should I also apply for supplementary health insurance? Is Medicare C the supplementary, or is it an Advantage plan? So there's a lot of questions in there. Mm-hmm. So already 66.
Okay.
67.
And they are they taking?
Social Security? Taking Social Security.
Okay, good. So you're enrolled. We assume that you have A only. So you returned the card because they would have put you on Medicare A and B. So you're on A only. Going to retire. So what you want to do now, really, anytime in the next 30 days. You want to have your employer fill out a form called the L564, verifying that you've had insurance and active employment, or your spouse, whoever had you covered. And that L564 is a form HR fills out, and then a form you fill out called the 40B. And then on the 40B, you will request what your B start date should be, and you're going to put on that, begin my Medicare Part B January 1. So employers verifying that you've had coverage, the 40B. tells them when you want to start it, and you're going to submit both of those documents to your local Social Security office. You can fax them in, mail them in, drop them off, and request a January 1 start date. And so you already have your A, and so that you have your A number. So on that 40B form, you can put that Medicare number at the top of that form and submit those, and it'll be a very seamless transition. And then, of course, and by the way, our guides could fill all this paperwork out for you, and then email it to you, and then you can just print it off and take it to a local office. And then at the same time now, you can start looking at supplemental insurance, and the C plans are Advantage. There used to be actually a supplemental plan that was letter C. You can't get those anymore. That used to exist, but C plans are Advantage plans. Supplemental plans today, primarily people are getting G plans or N plans.
Yep.
And so you can start applying right now, and then when the group plan ends December 31st, everything else goes into effect. B goes into effect January 1, and your supplemental plan same time, and the drug plan.
Okay, plain old Steve says, will you help me compare my current employer plan to available Medicare supplemental plans? Absolutely. We do that all day, every day. Good rule of thumb, if it's over $250 a month, or if you have more than a $1,500 deductible, you're going to want to look at Medicare even while you're still working. So,
right. Yeah. And also income. Yeah. Because of IRMAs, but
oh yeah,
but our agents know all about that, and we're happy to make the comparison. And I promise you, we'll be honest with you. If your group plan looks like a better option, we'll tell you. If it's not, we'll tell you that too.
Okay, Beatrice says, any telephone number where I can call? I need to ask some questions. Call that phone number that's right underneath the screen right here. 800-864-8890. We are open 7 a.m. to 7 p.m. Monday through Thursday, 7 a.m. to 6 p.m. Monday through Friday. Those are all Central Time. Central Time. We're in Kansas City.
And you can call in and get an agent. That's live.
Okay, Terry says, I currently have an F plan. Can I switch to a G plan? I think it would save money. And the answer to that is hopefully, yes, you can switch. You give us a call. We're going to need to ask you some health questions in order to switch those plans. There's probably about 25 health questions. We're going to do a prescription drug check and make sure that we can find a plan that will accept you, because you are going to need to medically qualify.
And some companies are a little more strict than others, and we're aware of what companies will take.
Allison, good question. How much do you charge for your services? So our company, which is MedicareSchool.com, we do not ever charge you a penny. Our services are always free to you. Now, we do not work for free. Any insurance plan you buy, whether that's home insurance, life insurance, car insurance, health insurance, there's always a commission that is paid to the agent that helps you enroll in that plan. So our company is an independent brokerage. We are completely independent. We work in all 50 states around the country, but our services are free.
The insurance companies pay us.
Yeah. So, and there's no upcharge on the insurance. If you were to call United Healthcare directly and say, hey, I want this plan, or you work through us, it's the same price. There's no upcharge or anything for using our services. What we think we bring to the table is we put a high focus on what happens after you buy, right? A lot of companies out here, the goal is to get you on a plan, and then you'll never hear from them again.
Yeah. Or 8 times out of 10, you're transferred to overseas.
Yeah, the other side of the world. So we're 100% U.S. based in Kansas City, and just love and be an honor to work with you. Okay, the good question. We will end on this one. What do you think about high deductible G versus a regular G?
Mm-hmm. Okay. Well, I'm not a huge fan of high deductible Gs. If you feel like that's your best option, then that's certainly your choice. The negative of the high G is, yes, your premium is going to be a little bit lower, but you're going to be responsible for that high deductible. And so if you get sick, you're going to spend more money on that deductible than you would have on your normal G premium. Okay, so that's one. The second issue is, in order to get off the high G, you're going to have to medically qualify to pick up a normal G plan or an N plan or whatever you want. So if your health changes, now you're stuck on that. And since your health is bad, you can't move, you're probably meeting your deductible every year. So you haven't saved any money. But again, if you want to roll the dice on that, that's your business. I'm not saying it's crazy, but I think there's more risk with that than what I would be comfortable with.
Okay, I said that was the last one. We're going to do one more. I turned 65 in November, not retiring until December 31st. I'll be covered by an employer plan until then. When should I enroll for Medicare to start January 1?
Okay, good. So what you can do, the easiest way to do this, is to go ahead and do an application for Medicare A only. And you can do that real soon. So your birthday is November, so let's back it up. 3 months, November, October. So,
September.
Okay. Yeah, you're okay.
Oh, yeah, no, August.
August,
September,
you're ready.
yeah,
Okay,
yeah.
so what I would do, the simplest thing to do is to go ahead and enroll my SSA and then enroll in Medicare A only. Just do an A only application. So when it comes to the question on there where it says, do you want to do Medicare B, just say no to that. Now, when you say no, a warning flag come up and said, are you sure you don't want to take B? So just say no, I don't want B at this time. And so what that does is that's going to get you into the Medicare system. They'll mail you an A only card. And then what you're going to do is, because we want your coverage to start January 1, you're going to submit a form called the CMS 40B form. And you're going to submit that during the month of December. And you've got to do it in December because then they'll start you in January. And that way you don't waste any money on your Part B premium. So I would do an A-only application now, and then I would submit my 40B form in December and request on the 40B form, please begin my Medicare Part B January 1st. And it'll be smooth and seamless. And again, our agents know how to do all that. They're happy to do that for you, or that's the way you do it if you do it on your own.
Okay, guys, it's 6:30. We've been here for 90 minutes. This
Yeah.
has been fun. So thank you for joining us. Call the number on the screen if we didn't get to your questions. We couldn't get to all of them, and I apologize.
And we'll do one of these again in a couple weeks, 2-3 weeks,
We're
something
gonna
like
try
that.
to- yeah.
We'd love to answer more of your questions and be of assistance. And thanks so much for joining in. We really, really appreciate this.